All right, so here I have my my model of the heart. So I followed all the instructions as per the video. I have 3 just regular water bottles here that I've emptied out. I have filled the first 2 between like 75–80% full with water that I just added some food coloring to, and then I have my total of 4 straws. So I have them attached there in the center with tape. In that middle bottle, I've put Play-Doh around it there just to kind of create that seal. So there's obviously 2 straws, 2 holes in that bottle, and then the one here on the far left, I have 1 straw entering, and then there is 1 kind of pinpoint hole there in the top. So as we learned in the model that was demonstrated there in the video, in that situation, our middle bottle acts as the ventricle, and then the far left-hand bottle acts as the atrium. And then the empty bottle that I have on the far right-hand side, that one there would be representing the body. So as we know, the heart not only kind of circulates oxygenated blood to our body parts, it also intakes deoxygenated blood from our body and sends it to the lungs to become oxygenated. So in this case, since we have blood going to the body, we would know that our bottles there that have blood or water in them, those would be representing our left ventricle and our left atrium, since it is that side of the heart that circulates oxygenated blood to our body. So like I said, that bottle on the far right represents our body, and from the left ventricle is where we have oxygenated blood that then goes to the body. All right, so as we know, the straws that we've put in, those act as valves. So by squeezing one of the straws, we're replicating what valves do within the heart. So they open and close to allow for blood flow. So in order to demonstrate blood from our ventricle, which is our center bottle here, entering the body, I'm going to squeeze the valve that would connect the atrium to the ventricle. So I'm going to squeeze that, and then by squeezing this bottle here, we see that it is putting blood into the body. The main function of our heart is to propel blood through the body. It delivers oxygenated blood and nutrients to body tissues and deoxygenated blood to the lungs to become oxygenated. So how does it do that? First, let's talk about what causes our heart to beat. The synovial node is the specialized structure in the heart that establishes the beat, also called the pacemaker. This is located in the right atrium, and it causes contraction in the movement of blood through the heart. So what is the pathway of blood as it travels in its cycle? Well, deoxygenated blood enters the heart through the superior and the inferior vena cava. Both of these deliver blood from different parts of the body to the heart. So the superior vena cava brings blood from your upper extremities in your head and neck, and the inferior vena cava brings blood from your lower extremities and abdominopelvic region. It enters into the right atrium, and the SA node causes the contraction of the right atrium, pushing the blood through the tricuspid valve into the right ventricle. From there, the blood travels through the right semilunar valve, which is also known as the pulmonary valve, and into the pulmonary artery. The pulmonary artery brings the blood to the lungs, where it becomes oxygenated, and then the pulmonary vein brings it back to the heart. Up to this point, this is what's known as pulmonary circulation. Then it is referred to as systemic circulation, which is more what this model is demonstrating. So now oxygenated blood enters the left atrium, which is the far left water bottle, and passes through the mitral valve, which is the purple straw, into the left ventricle, which is the center water bottle. As the blood passes through one valve into the next chamber, the valve closes behind it to prevent backflow, and this is true for the valves in the heart. Once in the ventricle, it travels through the left semilunar valve, or the aortic valve, into the aorta, which allows it to travel to all the different vessels throughout the body, which is represented by the green and blue straw, the aortic valve and the aorta. Then this cycle starts all over again. So arteries carry oxygenated blood away from the heart into the body tissues, and then the veins bring it back to the vena cava to go through the cycle again.